Good morning, ladies and gentlemen, wherever you. I'm sorry, there is some feedback. Please remove your. Once again, good morning, ladies and gentlemen, from wherever you are watching or following this across the world. My name is Larry Liza. I serve as the director of the World Customs Organization in East and Southern Africa, based at the regional office for capacity building. The World Customs Organization brings together 183 member countries, and the East and Southern Africa region has about 24 countries. While our key mandate is in supporting international trade and developing international standards to support trade across the world and for the region, we decided to do this research as a give back to the society, hoping that by looking at a case study, we can leverage on these across the world, especially in developing countries, developed countries, to see what we can do. So I'll just go to my presentation right now. And we did a study. We are sharing a screen right now. We did a study on the effective use of masks as a preventive measure against COVID-19 in urban areas. This particular study focused in Nairobi, which is the capital of Kenya, and that is where we are hosted. So in this particular study, before that, to just give you a background, I think I've mentioned that the East and Southern Africa region has 24 member countries. We speak 3 official languages, English, French, and Portuguese. And we also support member administrations, customs and revenue administrations in training. So we are hosted in Kenya by Kenya Revenue Authority. That's the background I wanted to give, but also to point out that there are 6 regional offices for capacity building in the world. The regional offices include this one in East and Southern Africa. The other regional office is in charge of Europe. There is another in Americas, which takes into account, supports both North and South America. Then we have Asia Pacific, we have Middle East and North Africa, and we also have our Central and West Africa. So back to the study that we did. Nairobi, which is the capital of Kenya, accounts for a majority, over 60% of the COVID cases that have been reported in Kenya. And just like globally, Nairobi has also shown a higher number of men getting infected from COVID, that is morbidity, or dying from COVID, that is mortality. But the WHO has underscored the importance of masks as a measure against COVID, up to 50% prevention. This is primarily because COVID is transmitted through respiratory droplets. So if you cover the mouth more than ever, you are likelier to prevent COVID getting into contact with you by up to 50%. But what we saw that while masks are there, some may not be wearing masks correctly. And so we decided to do this study with particularly 2 objectives. One was to investigate the awareness and the adherence of masks, adherence to the guidelines on the wearing of masks in public as a preventive measure. And secondly, we decided to check the considerations and attitudes of the population in wearing masks. So in doing this, we had certain objectives. The first objective, the first methodology under the first objective, which looked at the guidelines, the adherence to the guidelines, we did an observational drive-through across different societal classes. This included the upper class and the middle class and the informal settlements. And we used a methodology called estimating proportions for a population of up to 383,000. And when we came to looking at the considerations and attitudes on wearing masks, we interviewed 1,152 respondents through virtual questionnaires and calls. And we did these on Google Forms. We spread these on Google Forms and spreadsheets, which we then focused onto the data analysis that we are presenting here. So I'm going to share the first results on the adherence of the public to the wearing of masks. What we noticed, remember I mentioned that we did this in the middle class, in the upper class, as well as the informal settlements. So overall, in public places, we noted that 58% of the residents of Nairobi are wearing masks, meaning 42% are not wearing masks. Yes, but then when we looked at this much deeper, we noted that overall, more women are wearing masks compared to men, a total of 62% of women overall, compared to 56% who are wearing masks. But we went ahead and noted that wearing masks is one thing, and wearing them appropriately is another thing. So having a mask, some are wearing it on the chin, wearing them on the neck, and so on. So when we checked among the population that was masked, we found out that 64% of them are wearing them appropriately, meaning still 36% of them are not wearing them well. And again, women overall showed better responses to adherence of the wearing of masks in public. 73% women wearing masks compared to 58% of the men. So when we did this, we then went to the upper classes, because I've just presented the overall picture. The upper classes in Nairobi include places like Karen, Runda, Kitsuru, Lavington, and different areas. So under the upper class population, in public places, we noted that 100% of the people were wearing masks. And public places means places that are literally public, and we have at least more than one person in a cluster. We were not looking at someone who is on their own, at least someone who is in a position to transmit or protect themselves against COVID. So for example, if we checked a mall like the Hub in Karen, then we noted that 100% of the people in public places in those areas had masks, and both men and were wearing their masks appropriately, up to nearly 97% of both men and women. And then we came to the middle class and we began seeing a difference or going down. Remember, the upper class, 100% had their masks on, and 97% of them had their masks appropriately worn. But in the middle class, 83% of the people had their masks worn. And only 64% of these people had their masks worn appropriately. So we are already moving from 100% in the upper class to 64% who are wearing their masks appropriately in the upper class. But again, we noted something, that women were responding more to the wearing of masks. So by the time we were getting here and seeing more women wearing their masks better, we asked ourselves, could this be one potential reason more men have a higher morbidity and a higher mortality? We had assumed that we would find maybe more men or more women outside. We didn't know who to find outside, but we found that more men were outside in public places compared to women. And it might make you think that the population of men is more than women, but when we checked with the Kenya National Bureau of Statistics, the ratio of men to women is 1:1 in Kenya and in Nairobi. If anything, it is 1 to 1.02 for women. So it's almost 50-50, but we still found more men in public, showing that at this particular time, more men are still willing to go out there to expose themselves more than women. And remember, they are out there and more of them are not wearing their masks appropriately. Then we checked and we said, or maybe more men are working compared to women. And when we checked these, we then found out, we checked with the World Bank and again the Kenya National Bureau of Statistics, the percentage of men And women, the ratio of men to women working in Nairobi and in Kenya is 1:1. So it kills the perception that more men are working compared to women. The only difference is the rate of income. So more men are earning more than women, but out there, there's Mama Mboga, there's someone selling clothes, someone in the market, someone going to fend for her children, bringing this number 50-50. But you can still see women adhering better to these guidelines. So it has nothing to do with men working harder or more men working compared to women. And it also has nothing to do with the population of men being higher or women being higher. So we see a lot of complacence in men, and they expose themselves a little bit more across the divide. When we went to the informal settlements, these are the slums in Kibera, Kawangware, Wamichael, or Kiamaiko, and so on. The results were even sadder. From 100% in the upper class to 83% having masks in the middle class to 31% having masks in the middle class. And among these masked population, the ones who are wearing their masks appropriately goes down further to 48%. Remember, 98% in the upper class, 63% in the middle class, and 48% in the informal settlements, as we prefer to call them, as opposed to the lower class. And again here, women are faring better than men. So the ratio of women adhering to these guidelines in the lower classes are 58%, 55% compared to 41% of men. And then the second objective of this study I mentioned was checking considerations and attitudes of the population in the use of masks. So when we did this, suffice to note first, there's a graph that is coming up. We checked the distribution of our respondents, the 1,153 respondents. And we noted that nearly 85% of our respondents were between the ages of 18 to 40. And again, when we check to the Kenya National Bureau of Statistics, this is the population that is out there working more than, not harder, but more than anyone else in regards to numbers. So these are the people who responded to us. And one of the things we checked was the sources of information regarding COVID. We noted that people are getting their information on COVID either from social media, from television, from word of mouth, from newspapers, and from the radio. So social media includes the likes of Facebook and Twitter and WhatsApp. However, one thing that we later noted is that the app TikTok is really picking up and has really picked up in the country as it has done across the world. So these are places the government might want to leverage on to share information and to do adverts, either using the TikTok celebrities or just putting adverts that will share more information. Nevertheless, we checked the exclusivity by sources of information across these classes. For example, while all these are being used in the upper class, TV, for example, enjoys 47% exclusivity in the upper class compared to 26% exclusivity in for social media. But when we go to the upper class, both social media and the TV were used a lot. People were home to watch news, to always follow up, and to follow up on WhatsApp, on Twitter, on Facebook, etc., information regarding COVID. But why the TV even got more traction than you would have imagined for social media is because of the daily government briefings. So you'll find that every day, either the minister or the two CSs are out there, and people would always check to see what they were saying on that day. And then social media, people would leverage on it, especially those who missed, to get the summary. At some point, people grew, I don't know if to say bored or tired, and were not 100% glued on their televisions to watch these. But the most remarkable one you will notice is the sources of information in the middle class, in the informal settlements, word of mouth. So most people in Kibera, in Kawangware, in Kahawa, the main major informal settlements in Nairobi were getting the information either from friends or from relatives or from passers-by or from shops or across centers where they gather, and most importantly, from the NGOs that are based in the areas. In Kibera, for example, we have, I think, Shofco, which has set up different centers and other NGOs. So more people are getting information here. Sadly, in the informal settlements, newspapers registered very limited readership. So anyone wanting to pass more information in the middle class, in the informal settlements, might want to focus more on the use of word of mouth using the local administrations and so on. But after that, or as we were doing that, we also checked the choice of masks, taking into account that we have 3 types of masks. We have the reusable masks, usually made from cloth, and we have the disposable masks. And then we had a choice of those who are using both. So when we checked the upper class is mainly preferring the disposable masks, which they can use and then dispose, followed by a mixture of either disposable or reusable. The middle class was divided 50-50 on the use of masks. Half of them are using the disposable ones, the other half are using the reusable. And then the majority, half of the total, have at least both reusable and disposable. But check the informal settlements. A majority are using the reusable masks, either made from clothes at home, etc., etc. Why? Because they know they can use the reusable masks longer. It is probably much cheaper. We also did something on pricing that I'll be talking about next. So it was much cheaper for them to use the reusable masks. And then we checked the mode of acquisition. Are they buying these masks? Are they getting them as freebies? Are they making them at home? Are they getting them from all sources? And a huge majority of the people are buying their masks. But the sad thing is, informal settlements are buying their masks much more than people in the middle class and in the upper class. To mean, more people in the middle class and in the upper class are getting masks free. More people compared to people in the informal settlements. Why? Because you might be working for a media house, you might be working for an international organization or a government body, and you are provided with masks. And a majority of these people fall between the middle class and the upper class. So they are not buying the masks. They are still buying some masks either way, as you can see, a percentage of over 70%. Nevertheless, they have more freebies at nearly 10% for both classes compared to 7% in the middle class. So in the informal settlement. So this is a point of concern that the government or the necessary people might want to see if they can provide more freebies to the informal settlements, especially to the vulnerable society. And then we checked the price considerations. How big a deal is price for you when you are buying the mask? And guess what? The informal settlements, according to them, the price was a big deal. Nearly 9 out of 10 say the price has to matter. The other percentage maybe is making them at home or cannot even buy it in the first place. So many of them looked at the issue of the price. But surprisingly enough, the upper class is also a little bit more cautious about the price more than the middle class, as you can notice. But by and large, a majority of people have between medium and a high focus on the mask price in the middle class and in the upper class, while an ultimate majority in the informal settlements are looking at these. And then we checked the vendor location. Where are you likely to buy your masks? The vendor location. And as we were checking that, as again, we checked the three classes. To the upper class and the middle class, they were really fussy about the vendor location. They are either buying it from stores, from shops, from supermarkets, from chemists, and so on. But in the informal settlements, it didn't matter. It's easier for someone from the informal settlements to buy his mask on the streets, to buy it from a tailor next door, because their big issue is the price. And so they are focusing on the price and on the reusable masks. So for them, that was very, very important, and they gave very low consideration. It didn't matter where they are getting their masks as long as they can get them. So as we conclude, ladies and gentlemen, the point and the conclusion was we hope to ultimately publish this study in one of the major international journals, which is going through it right now. Probably it will be published next week. And largely, the adult population is largely aware of the importance of wearing masks. This adult population assumes the adult population of sane mind. So there are people who may not be of sound mind, that may not be fully comprehend these. But this adult population has not fully embraced the importance of wearing masks as a preventive measure. You remember at the beginning, I pointed out that the WHO has said that masks can prevent up to 50% of potential infection. And we also noted that people in the upper class and in the middle class are adhering more to the guidelines compared to people in the informal settlements. But it is about the socio-economic divide. And of course, you have also seen how women are adhering more to these guidelines. When you look at women, there are other issues that have been explained, probably relating the genetic makeup of women, etc. But this also shows the issues of complacence, more complacence in men. So we would probably want to point out that as we do campaigns, we continue campaigning more. You remember the rate of cases now is at about 5.7% in Kenya. So if you've been following this, we have been going down as a country. So if this is sustained when we get to 5% and sustained for 14 days, Kenya can comfortably say that they are beginning to bend the curve or to flatten the curve. But we have to continue upscaling the use of masks, adhering to other guidelines and protocols like social distancing and washing of hands. But imagine, considering what men are doing, if we did targeted campaigns to men, whenever the minister is giving his speech, he can take a few minutes to talk to men. You know, the couples who will be watching in their houses, the wife will look at the husband and say, look, I told you, this is what he's talking about. And then we can do sustained campaigns leveraging on the various media that is used in different areas. If social classes are preferring social media, then we can focus our campaigns. Media houses can focus their campaigns more on the social media, you know. If they are in informal settlements, you can leverage on the word of mouth. And then we need to probably support the informal settlements and the lower classes in wearing these masks. Finally, we tried to do a study on the nature of disposal and how often they were disposing. But this was dead on arrival. Why? Because everyone said they dispose of their masks in one day. And when you do observations and other empirical studies and evidence, then you notice that they are not really saying the truth. So we would probably call for more studies on disposals, because people are out there saying they dispose their masks in a day, but we know the reusable ones, they don't clean it after a day. And these ones, the disposable ones, they also use it sometimes more than a day. The best that some do, they spray it with the sanitizers in the middle class and in the upper classes before they dispose of it. And some of them are also washing the disposable masks. So, ladies and gentlemen, following this from across the world, we take this opportunity to thank you from the World Customs Organization, East and Southern Africa office. And we will share this presentation with all our member administrations in East and Southern Africa. We are grateful to all the countries and to the hundreds of you who are following this online. Bye for now, and God bless you, and we shall continue keeping you posted as we continue working on our work in supporting the revenue administrations across the world. God bless you. Eric?